Good morning, students. All are well now. Today, I will be dealing with the patient record system or documentation. Patient record system or documentation. Patient record is a communicative tool. Patient record is a communicative tool. It enhances the efficient care. It is the essential component in nursing practice. It's a legal document. Then documentation is a system of recording either handwritten or electronically generated information regarding the care or service provided to a patient. Documentation is a system of recording either handwritten or electronically generated information is a computer regarding the care using the computer regarding the care or service provided to a patient. Next we will see the what is nursing documentation. Nursing documentation is a process of making an entry of data. Data means information on a record regarding patient's care and service provided to the client. Nursing documentation is a process of making an entry of data on a record regarding patient's care and service provided to the client. This is the nursing documentation. Next we will see the what are the purposes of documentation. What are the purposes of documentation? Usually there are 9 purposes for the documentation. First one is to facilitate communication. Documentation facilitate communication. Through documentation, nurses can communicate with other nurses and professionals in her team about the client health histories, diagnosis, planning, nursing interventions, outcome of the responses. She can communicate with the other health professional or health nurse about the client health history, diagnosis, planning, nursing intervention, outcome of the responses. Thorough and accurate documentation decreases the negligence and nursing errors. This is the first purpose. Second one is to facilitate coordination of care. To facilitate coordination of care. Nurses plan interventions and make decision and evaluate the patient progress, which is used by all team members. Then third one is to promote continuity of care. Third purpose is to promote continuity of care. Nursing documentation is a valuable tool to support the effective communication between the providers. Nursing documentation is a valuable tool to support the effective communication between the providers and also provide baseline patient information. This helps to continuity of care within the settings. Then fourth purpose is to promote quality nursing care. Documentation provide quality nursing care. Documentation encourages nurses to assess client progress and determine the effective interventions. Documentation encourages nurses to assess the client progress and determine the effective interventions. Nurses can use information to make clinical decisions for nursing diagnosis and planning care. That is to promote quality nursing care. Fifth one is to achieve professional and legal standards. Documentation achieve professional and legal standards. Documentation is a valuable method for demonstrating nurses are performing according to professional standards. Documentation is a valuable method for demonstrating the nurses are performing according to professional standards. Then, the health records of the patient serve as a legal record of the care or services provided. So, it is a purpose to achieve the professional and legal standards. Next purpose is accountability. Nurses have the responsibility to apply nursing knowledge and skill in providing safe, competent, ethical care to the client. Nurses have the responsibility to apply nursing knowledge and skill in providing safe, competent, ethical care to the patient. That is the accountability. Accountability is a responsibility. Nurses have the responsibility to apply nursing knowledge and skill in providing safe, competent, ethical care to the client. Next one is security. Next purpose is security. Nurses ensure that the relevant client care information is captured in the permanent record and safeguard the client information by maintaining confidentiality and enacting by information retention and destruction of policies. Then, ninth one is providing quality improvement. Documentation providing quality improvement. A healthcare record is often a tool used within the quality improvement process to evaluate the service provided and outcomes achieved. Healthcare record is often a tool used within the quality improvement process to evaluate the services provided and outcomes achieved. Next purpose is facilitating evidence-based practice. Healthcare record can be an essential source of data for nursing and health research and provide evidence. The healthcare record is an essential source of data for nursing and health research and provide evidence. These are the purposes of documentation: to facilitate communication, to facilitate coordination of care, to promote continuity of care, to promote quality of nursing care, to achieve professional and legal standards, accountability, security, providing quality improvement, facilitating evidence-based practice. Next is the types of documentation system. Types of documentation system. There are two types of documentation system. First one is paper-based or traditional. Second one is electronic documentation system. Two types of documentation system. First one is paper-based or traditional. Second one is electronic documentation system. First one is the paper-based or traditional system. Paper-based documentation system is again divided into 5, that is source-oriented records, problem-oriented medical records, Charting by exception